Hi, this is Mckenzie from the Texas Institute for Excellence in Mental Health, and you're listening to Research to Reality, conversations on mental health research and innovation in Texas. Today, we're excited to bring you our very first episode, the early childhood mental health landscape in Texas.
It's almost a bittersweet that we're walking into a time in this field where it's uncharted territory. We understand that there is infant and early childhood mental health, and we understand that there are some services to support it, but we also have maybe not yet knowing what is to come.
And I think what I would want to say is that it is equally important that we are investing in our young children's social emotional wellness and mental health, because that really sets the stage for their physical health, for their relational health, and for their learning.
Research to Reality is a podcast from the Texas Institute for Excellence in Mental Health, brought to you by the University of Texas at Austin School of Social Work. The opinions expressed in this podcast represent the views of the hosts and guests, and not the official views of the University of Texas at Austin. To help us explore this topic, I'm excited to hand things over to our co-hosts for today, Jenny Baldwin and Holly Gerslin-Becerra, both Senior Administrative Program Coordinators at the Texas Institute for Excellence in Mental Health and co-directors of Infant and Early Childhood Initiatives. Together, they bring decades of experience working in the landscape of infant and early childhood mental health and behavioral health. Holly and Jenny, welcome.
Hi, thank you for having us.
Yeah, good to be here.
So my name is Holly Gerslin-Becerra, as Mckenzie mentioned, and this is my colleague Jenny Baldwin, and we are really excited to be here and really excited to get started. So we'd like to introduce our special guests for today. So first, I have the pleasure of introducing a colleague, mentor, and motivational visionary, Laura Kender. Laura is the Chief Program Officer at My Health, My Resources of Tarrant County and oversees a range of person-centered programs and services. Laura holds a master's degree in educational administration with a focus on early childhood and special education, and we are so lucky and excited to have her with us today. So hi, Laura.
Hi, thanks for having me.
And next, I have the exciting opportunity to introduce Molly Lopez. She's a leader, a systems changer, founder and director of the Texas Institute for Excellence in Mental Health that's located in the School of Social Work at the University of Texas at Austin. Molly received her PhD in clinical psychology from Texas A&M University, and she's a licensed clinical psychologist with over 25 years of experience in program evaluation, program management, grant writing, and research dissemination. Molly, welcome. We're so thrilled you're here today.
Thank you, Jenny. Excited to be here.
So I guess I want to start out with a little bit of context setting. I feel like in the world today, the community, they're just getting the grasp of adult mental health. So in general, they understand what adult mental health is, what it looks like, and its implications. But the idea that infants and toddlers also have mental health or mental well-being can seem really difficult to understand. And so, Laura, help us set a stage a little bit. When I say infant and early childhood mental health, what does that mean to you, and why does it matter?
And I think that's a great way for us to start. It's really, if we can do the comparison of physical well-being and health and mental well-being and health. We oftentimes focus a lot on the physical well-being and health, and we do not focus as much on the mental. And so when we think about early childhood in that respect, we're often thinking about, and I even think about some of our early childhood programs, we assess their speech and language development. We assess their physical development. Are they walking? Are they meeting their developmental milestones? All of those types of things. And it's equally important to us for us to focus on their social emotional well-being. And when I say that term, really to look at how are they developing in the areas of their emotions and their ability to regulate behaviors? Do they have joy? Do they respond when somebody comes to them? Do they smile? So all of those things that we would think about in terms of mental well-being. So I think oftentimes when we hear infant and early childhood mental health, people oftentimes want to go to mental illness, or is there a mental health concern? And certainly we're focusing on prevention and promotion and development in the mental health arena. But when we say early childhood mental health, we really are focusing on promotion of mental health, prevention of things that might impact a little one's development in the social emotional realm. So we really are thinking about how are we promoting healthy emotional development in young children? How are we strengthening the parent-child relationship? Because we know that that is how it develops. Social emotional is through attachment and relationships with others. So kind of thinking about, I oftentimes separate the three: the social, the emotional, and the relationships. So, and then you can't look at a little one without looking at the adult or the caregiver in their life. So we're equally focusing on the adults in their life and their ability to support their development. So focusing on those relationships. Do they have a secure attachment with the caregiver? Looking at their emotions, what experiences are they having? When they cry, does somebody come and help them? Those types of things. Do they have opportunities in a supportive environment to explore? And I would say that we're going to extend this into the prenatal stage as well, because we want these moms to be healthy as these babies are developing also, because that certainly impacts the brain. So we're really talking about brain development. Do they have these opportunities? When we're thinking about how do young children learn how to talk, young children also have to learn to relate to others.
What I'm hearing in this discussion or definition even of infant mental health is that it's complex. There are many pieces, there are many definitions, there are many parts that go into defining infant mental health and well-being: brain development, relational health, emotional well-being, what's their environment and how is that impacting them. Molly, I want to ask you the same question. When we talk about infant mental health, what does it mean to you and why does it matter in a broader scope?
A lot of our work as we think about mental health, as we talked about, we think about adults, or sometimes we might think about adolescents. But we know that mental health really starts much earlier than that. And as Laura just mentioned, it really starts even prenatally. We want to make sure that our mothers have the best experience possible, because we know that some mental health concerns can actually go across even different generations. Mm-hmm. So as the more that we can do to support our mothers, the healthier our young children are. And really, when I think about the importance of it, it really comes back to prevention. We know that we have the best chance of helping young people have the best possible life, whether that's their educational experience, their relationships, their opportunities to achieve all of their different goals. Really, that comes from a very strong, healthy start. If folks don't have that good experience, and that is going to be what happens for some folks, having caring adults around them helps buffer those negative experiences and build those areas of resilience so they can get back on track to have that best possible life. So prevention is really important. We know that we can support children in having strong mental health when we act early, when we help prevent negative experiences, and when those negative experiences happen, when we support children and families to get through those.
So all that to me sounds like infant mental health is how a child learns from their caregiver and how well their caregiver is, that relationship between the caregiver and the child, and then how the environment impacts the two of them together. And all of that combined with their physical development, their coping skills, even maybe kind of where they are in the world, all of that then creates a mental health in an infant and a young child.
Yeah, and I think what we're talking about is so important because we really are talking about mental health as something that begins even before birth. So we know that mental health is something that spans the entirety of our lives. So of course it exists in young children as well. So in that sense, we also know it could have an impact on children's development even from the very beginning. And that's why early childhood mental health really matters. So I'm curious, Laura, how do you see mental health impacting a child's development? And could you maybe paint a picture for us of what you see with families that you and your organization works with in that respect?
Much of what we do try to focus in that prevention and promotion stage. So what we're really trying to do is equip our families with the skills that they need so that we can see healthy mental well-being. So we are really looking at how do we alter our environment so that we can make environments supportive? How do we focus on the adult caregivers so that they can be strong and available to the children that they're raising? So oftentimes when we get a call about a child of concern that somebody's wanting us to step into, we can oftentimes go back into their history and identify things that may have impacted their mental well-being. And so sometimes in answering this question, it's really helpful for me just to say, okay, let me tell you about a few cases. Here's a few children that have presented to us, and this is probably what happened, which resulted in maybe some behaviors that we see. And I use the word behavior because oftentimes that is how a young child's going to let us know that something right now they need some attention, and we're following developmental milestones and what should be happening with emotional regulation, what should be happening with how children communicate with us, but it may be through some type of behaviors. And so sometimes we'll get referrals or folks will call us when they're experiencing little ones that are having difficulty controlling or expressing their emotions. We may have children that lack verbal language and are not able to let us know what's going on. So therefore, they're going to display behaviors as a result of that because they're going to let us know. And it may be that they have an inability to express that with their language. We sometimes see families that will call us and the word hyperactive has been used, or ADHD. They're already getting diagnoses on their child at a very young age because somebody has mentioned that word to them. Or they might come to us and say, my child just seems to be a loner. They don't really want to be with others. And I would say the same is true with child care centers. We'll get a call because there's a child that perhaps is quite disruptive in a classroom. And, the call is going to usually be about, can you come and fix this child? Rather than, let's look at what's going on in this child's environment and across all environments. We can't just look at that one environment and see what's going on. And in their history, what might have been happening as well. What we seldom get is the call from the child care center about the child in the corner, because that child's not causing disruption. And oftentimes we know our child care teachers are, that's a hard job, is to be in these classrooms with multiple children under the age of 3. And so typically that child may not get alerted to us as quickly as perhaps the child that's expressing it more verbally or through their behaviors. We might see difficulty with relationships or with not being able to make transitions very well. So maybe needing quite a routine, and if that routine gets disrupted, having challenges with that. So then we start exploring, okay, what could have gone on in this child's life that may have disrupted what we would typically see as the typical reaching of developmental milestones and behaviors. And so when I describe all of these physical manifestations, they can result in impact to our emotional status as well and our social emotional development. So you may have children that are high alert, or they may be numbing, that's the way that they're attending to it, or they may, in those instances, they haven't had the typical caregiver interaction. So they haven't developed a secure attachment with an adult. Perhaps that's insecure. So when you say, what does this look like with a child? Oh my goodness, such a wide variety. And we know that it impacts children so differently. But I think the emphasis here being that during this period of a child's life, so much of the relationships that they have with other people or the environment that they're in can sometimes impact their mental well-being.
Yeah, thank you so much. You mentioned attachment. I think that's a big one when we're talking about this stage of life and mental health. Can you explain for us what a secure attachment versus an insecure attachment might look like?
Yes, and when I use the word secure attachment, I often use that example I used previously. When I cry, somebody comes. And I think when we're talking about secure attachment, it's that reliant on another person, and we attach to them because we know that our needs are being met when they need to be met by a responsive caregiving adult. When we have breaks in that, then we develop other behaviors to try to circumvent or to fill that void that might not be there. And we see this attachment continue into our adult life. You will see people that have a very secure attachment much confidence in when I have a need, somebody else is going to help me with addressing that need. And others who might have learned that nobody else is going to address this, I need to figure out how to take care of it myself. And we see that even in our adult behaviors as we get older, because it's so set into our responsiveness at a very young age.
Yeah, it's kind of like those ways that we learn to interact with each other as young children then are manifested, right, in our relationships that we have going through the stages of life and has a longer term effect. So, yeah, when we're thinking about what does this all mean for long-term impact for kids, this relational health piece, the attachment, all of this together, behavioral health, Molly, can you kind of talk to us a little bit about what some of those long-term impacts for young children could be?
Yeah, absolutely. If we go back to thinking about our very youngest children, right? And as Laura mentioned, when they have a need, when they're feeling hungry, when they're not feeling healthy or they're feeling sick, they use crying, right, to reach out to a caregiving adult. And that cry helps them realize that somebody can step in and help me feel more comfortable, help take care of me. As our children get older, that environment begins to expand a little bit, right? So after that first caregiving relationship, we might also bring in teachers who help take care of us. And even as we start to get a little bit older, to like 4 and 5, how are we thinking about other children that we might interact with? And those early experiences really affect how we think about other people, how we think about the world. Is our world safe? Will people help keep us safe? If we have a challenge, if we have a problem, can we depend on those people in our lives to help us overcome that challenge? And as we mentioned before, those patterns really do start to map into our actual brain development. And when we feel like when I am worried or challenged, somebody's going to help me, that starts to kind of build a little routine in my brain. And I start to see the world as a safe place that even though I may go through something, there's going to be people to help me get through that. And on the opposite side, if I feel like my world is not so safe, that people may not be there for me, or may even be something that I need to feel scared about, those patterns also start to build up a little bit. And as I get older, I may not trust people to really help me in that same way. So as we start to expand our environment and start to be involved with adolescent peers, we start to think about relationships we might have with romantic partners. Some of those same things can play out. I might not trust my romantic partner to really be there for me, or I may try and test them to see will they meet my expectations of being there or not being there. And those patterns can really start to build into some problematic things as we get older.
Yeah, it sounds like maybe even we could say unsafe behaviors or situations.
Sometimes I think that's possible. And sometimes it can be things that really just don't set us up for the healthy relationships, the strong positive experiences as we go out into the world that we really want all young people to have.
So I think infant mental health is such a delightful, complex topic that sometimes when we start talking about it, we can start using the jargon that's in the field or a lot of terminology that maybe our listeners aren't always as accustomed to. And while I'm listening to you both talk right now, I thought it might be helpful to take a step back for a second. Think about some of the terminology that we're talking about and help folks kind of connect things that they're hearing in the community, the experiences they're having, things that they're hearing from doctors to what we're talking about. We are hearing topics like relational health, but we also talked about social emotional learning, social emotional development. And so I just want to take a quick second for us to kind of lay some foundation. When people hear those terms like social emotional learning or social emotional development, what does that mean and how is it connected to early childhood mental health?
Yeah, I can step into that space a little bit. Maybe starting a bit with when we think about how our young children learn, we know that there's developmental milestones that we're monitoring for our little ones and expectations that we have about when they obtain certain skills, which coincide with how the brain is developing, right? But we also know that not all of those things just happen. They happen because we purposely and intentionally create environments and opportunities with our little ones that are rich, that help elicit those milestones and help with that development as well. And we often see that with children who are exposed to those opportunities versus children who are not. We see differences in how they develop. It's not that different with our emotions in terms of our mental health as well. So I think it's not as foreign to folks to think about, oh, by the time my child's this age, they should be walking. And I naturally, throughout their first year of life, introduce opportunities for them to develop those skills. So that's something that I'm more acquainted with. What I'm not as acquainted with is what are those things that I teach or help my little one with that are intentional, that are helping to develop things such as their own self-awareness. We want them to be aware of, I'm mad. What does that mean? How do I tell somebody? Or their own way to manage themselves when they're upset. And when they want something, how do they communicate that? Or how do I relate to others? Or how do I play with others? How do I be in a room with other little children and play? And that doesn't just come naturally. And so when I think about social emotional learning, I define that more as that intentional process that we're putting in place to help teach and learn some of these skills. It's more that structured. How do we show calming strategies? How do we help with skills that help children to understand and how to manage their emotions? We do a lot of that through role playing. We do a lot of that through teaching. We do a lot of that through demonstration so that they can see it and then practice it as well. But I think oftentimes that intentional, how do we learn these skills? Now, when I think about social emotional development, it's kind of the other side of that is that as we've talked about brain development, we've talked about kind of that natural growth of these abilities. So there is natural growth to this. There is the brain development. There are developmental milestones that we're looking at. There are things we're looking at certain stages in their life that would be expectations of what they're able to do at this point in time. So I kind of distinguish the two with this is kind of the trajectory that we would be looking at with social emotional development and social emotional learning being kind of how are we intentionally teaching and helping little ones acquire those skills. And then I think when we think about social emotional development, we're thinking about the brain. That's when we talk about adverse experiences and how adverse experiences at some point in time during that natural development of social emotional development can have an insult or impact to that development. And that's when we get a little bit into now what do we do as a result of that.
Yeah, and I think that what do we do kind of brings us to how mental health and behavioral health differ. I heard you talking earlier about we don't always get the attention from a provider, a teacher about the child who's maybe being quiet in the corner, but we do get calls and referrals about the children who are developing out loud, the ones that we can see, the kind of big behaviors. And so I want to talk about that difference a little bit, the mental health versus behavioral health. And Molly, how are they different and how do they connect to kind of children's well-being and children's mental health?
Yeah. Well, as Laura was talking about our social emotional development and the learning that can happen, that is really setting the stage in many ways for our mental health, right? Our overall mental health. We know, though, that as children who are developing language, a lot of times what we as adults might say is, I'm feeling really upset right now because I've had this experience. For young children who are really just developing language, those words aren't there. They may not recognize what they're feeling. It may feel much more physical at that moment. And sometimes those things are really displayed and communicated really more as behaviors. We talked a little bit about how the infant might cry out to get comfort and support from a caregiver. It really is very much the same for a slightly younger child who's trying to express really complicated feelings that they don't fully understand in ways that get them support, help that they may need. Now, as adults, we may not really understand what they're trying to communicate to us. And so what we may see as a tantrum that we need to quiet because we're in the grocery store and it's embarrassing to us. For that child, there's probably some internal feeling that they really are trying to communicate and get support around, and they just don't yet have the skills to do that. So the development of those skills and ways to cope and address that intense feelings that we may have or the sense that we may not be safe, that's the development as we move into really strong mental health, that we can have awareness of those experiences, manage those behaviors so we are responding in ways that are helpful to us, that are appropriate within the society or within the setting that we are, and really gather some of those skills. When we are really young, we actually do that through that relation with a caring adult. And as that caring adult can provide calming messages through their body, their physical response, their breathing, perhaps even touch, it helps us regulate. And we call that co-regulation, right? That young child is actually sort of drawing from that caring adult to help quiet those feelings. And so as we get older and we have those experiences and we start to learn how to do that ourselves, we begin to build those skills for really long-term, strong mental health as adults to cope with all sorts of things that we all experience.
Yeah, it's sounding to me a little bit like our mental health informs our behaviors. And of course, we know this happens with adults all the time. And maybe we're not often or as often recognizing that that is what is actually occurring with young children.
And I think that's also what we're trying to talk about when we talk about social emotional development and learning, is how that then behavioral health turns into ways that and strategies that we can teach social emotional regulation, social emotional learning, social emotional coping. And so I think while all of those terms get confused for some folks or kind of complicated, they all inform each other. They're all building upon each other when it comes to the broader understanding, I think, of infant mental health. Mm-hmm. Yeah. We didn't talk about diagnosis, which I think is something that's coming up a little bit more often these days and can feel like a very sensitive subject. So just wanting to address that here and say while we recognize that some children don't receive diagnoses until their ages 5 or older, families are hearing about these terms like diagnostic terminology for mental health needs or infant mental health needs, I think a little earlier and earlier. And so how can we help folks understand the spectrum of where diagnosis fits into early childhood mental health and well-being, especially as sort of we're defining it right now? How do you think that diagnosis sort of fits into these different terms or into this landscape of infant mental health?
Well, I guess I want to start off by just saying that we know that children at this age are in a rapid developmental process with lots of impacts from their environment around them. So I think there is a very real and very logical hesitation to put any label on particular behaviors that may be happening. We know that when families get support and when children get support, many times some of those concerns that we have can actually be minimized and we can feel like kids are back on their trajectory that they want to have. So we want to be very hesitant in providing a label to a young child. At the same time, we also know that many of the challenges that children do get diagnosed with as they get into school and as they grow older, parents tell us that they saw concerns when their children were young. Yeah. And we don't want to ignore those concerns. When we ignore those concerns, we don't give families the opportunity to really figure out what supports that child might need in order to gain those skills and continue to develop in a way that we know that, that they have that opportunity to move forward. And so while I think we don't want to provide labels that can unfortunately stick with kids and families beyond the time that it's appropriate. We also don't want to ignore the early signs that there may be concerns, because that's our opportunity and our window to sometimes jump in and support that family in a way that can support the resolution of those concerns.
Yeah, early intervention is best, right? The earlier we see things and the earlier we can support families, the better outcomes. Yeah.
Yeah, and I think some of these even, going back to the idea of relational health, impact the people around them. Laura, could you kind of tell us maybe what you see on your end with that in those kinds of situations, either in the home or in places like the classroom, and how you guys navigate around that with your services?
It's what we hope to do at a young age is help explore. What is going on without labels. What's going on. Let's explore. Let's see what might be causing this, and let's see if there's things that we can do at this point in time to alter that or to support it. I would say at a young age, and especially nowadays, families are Googling things. They're going online. They're putting those behaviors online, or somebody else is telling them, and then they're coming up with these preliminary thoughts of what perhaps their child might have, and then that they're engaging in conversation about that. I think what we try to do is oftentimes use words like your child might be displaying characteristics of. So without actually labeling it, maybe talking about the behaviors as characteristics of things. So certainly not discounting what a family is feeling or what they're reading or what others are telling them, but trying to take opportunities to focus on what it is that we're seeing as characteristics, and then let's explore those things a bit at this point in time. Now, we do have children that come to us that a diagnosis has been provided, that somebody has already provided them with a diagnosis. I will say that what I'm seeing a little bit more of these days is words like provisional diagnosis or a preliminary, with a full recognition that a diagnosis can occur at the age of 3, and at the age of 6, it might be removed. And so I think oftentimes we think, once a diagnosis is received, it's forevermore. I think we recognize now that no, that's why we repeatedly continue to assess. And so I know diagnoses are important, answers are important. When you have questions about your child, you want answers. And sometimes that can give you an answer that you need that allows you to research and explore it. And identify ways to be involved in supporting your child at that point in time. So I would agree with Molly. There's kind of this fine balance there.
So to me, all of this says that infant mental health is a spectrum. There's, the relational aspects of it and how it develops depending on age. There's the environmental aspects, where they are, what their input looks like. There's the physical aspects of it and how that might mix with the medical world, different families' needs and readiness to understand infant mental health. I mean, I think it's just a huge spectrum and field. But I think one of the things we were wanting to do today when we were clarifying what infant mental health is to not only understand its definitions and its complexities, but then what are we doing about it? What does that look like in Texas? How are we meeting some of those needs? And I think you just had started to touch on some of that when Jenny was asking, what does your organization do around those supports and services? So yeah, and what resources do we have in Texas that are supporting families around early childhood mental health? And Molly, I'm curious, what is that? What is the landscape of mental health, behavioral health supports in Texas for children 0 to 5? What are we doing about it? What is here for us already?
Well, we do have some important structures in place that help support families. That can be prevention, where we are supporting community organizations in really helping frequently parents, right? Because that is that first important relationship. Parents have the skills that they need to know how to really monitor for that social emotional development and then build that social emotional learning into that child's day-to-day life. And I'm a parent, we are not necessarily taught how to do that at any one point, right? And it can be, if only,
Where's the book?
And those of us who are parents know that each child is also different, right? Mm-hmm. So if I might respond in a particular way with my one child and it seems to work beautifully, it may be absolutely the wrong thing with my next child, right? And so sometimes as parents, we need some support and help in figuring out how we might work best to support the social emotional learning for a particular child who may, have their own way that they need support. So prevention and support for mental health promotion is an important part of the system. We also have opportunities to intervene when we notice that a child's social emotional development is maybe not on track. And so if a pediatrician or a child care provider identifies that there may be some concerns about that child's social or emotional development, there may be things that they recommend as a part of the process to either kind of support that child's development or continue to monitor those early signs. But they may also refer families to supports like early childhood intervention supports to really help both further assess the nature of what is going on and provide that family and that child with some additional support. And when we think a little bit further about where we might have some more significant concerns and those children or families may need additional supports beyond that, we also have kind of the continuum of our mental health system. That can be, of course, private providers. That can be individuals who are integrated into like pediatric settings to really help support children. And it can even be individual therapists who may meet with families and with young children. Now, it looks a little different when you think about that level of care for young children because you're really not bringing an individual child in to do therapy. Again, you're working with the system, you're working with their caregivers and with their families, and you're working on that relational health. So it does frequently take a special kind of therapist who really understands this age group and has some evidence-based kind of best practices for working with young children. And we do have some of this kind of system across Texas, and we also have a lot of gaps. We have a lot of areas where families may not be able to access the kinds of resources that they need somewhere along that continuum.
Mm-hmm. Oh, a perfect segue for what I wanted to check in with Laura about. So thanks for the setup. What are you seeing, Laura, as far as kind of gaps in supports or services within that system that Molly's speaking to when we're thinking about care for children who have a need, who are experiencing something with their mental health or well-being? What are you seeing on the ground?
Yeah, and I think Molly did a great job of explaining. Always, it's good to follow Molly with what she just described because I can speak to some of the spaces that she was talking about as well. So I think, and we have to bring funding to the table, right? So funding has to be part of the conversation when we're talking about what's available and how does that pose perhaps, how do we allow funding to help support what we know is best in practices and not define what our practices are. That's really easy to say. That's not easy to do. And so oftentimes what we run into when we're identifying gaps is the way our funding structure is in the state of Texas. And so I think oftentimes we were talking about diagnoses earlier. Because we know that oftentimes we're not going to diagnose children at a young age, but our funding streams oftentimes are based off of diagnosis. And so sometimes we have these barriers that we run into in our ability to bill third-party providers because we don't have a diagnosis to attach to the billing stream. And we certainly don't want that to lead our practices, but it can become a gap and a barrier in our ability to fund some of these services as well. I think that we have to recognize, even when we talk about, and we touched on the early childhood intervention program, birth to 3, and I talked about the diagnosis, and certainly it allows that flexibility for developmental delays. But when you look at the array of services, it has counseling as one of the array of services. Well, in that instance, when we're talking about mental health supports to young children, we're oftentimes talking about the adult caregiver and the alterations in behaviors and the support that we're going to provide to that adult caregiver. It's not coming in and sitting with you on the couch and doing counseling, so it's defining what does that look like, right? What does that look like? What do we really mean by that when we talk about the array of services? And just as Molly mentioned too, when we get into our mental health system of care with our 3 to 5 year olds, and we're thinking about the young child and what are those evidence-based practices that we promote at that area, and those are those appropriate for this age group, and are those billable, and can we get those supported without a diagnosis, or do we have to have a diagnosis? So the whole thing goes together, in terms of our conversation about diagnoses. I think, and also thinking about cross-sector. So when we're talking about our little ones, we're often not talking about this is something that happens in a therapist office. We're talking about going into a child care center. We're talking about going into a family's home. We may be having a behavioral health provider in a pediatric practice. And so when you think about those settings as well, funding becomes a challenge, because we may not be able to bill because of the setting that we're in. If I put a behavioral health provider in a pediatric practice, now can I bill, or is everything under that pediatrician? So you have to think about how do we navigate that space as well. So I hate to be so the bearer of funding can sometimes be a challenge, has allowed us opportunities, though, I think in Texas, and you all have been instrumental in this over the last several years, to not let that stop us, but to recognize that what are other opportunities out there that will fund us to do what we know is best, which is this infant early childhood mental health consultation that you hear us talking about. And so when we really think about it, the term consultation at the end of that is very key. So when we talk about consultation, it really is about how do we focus low intensive to high intensive. And so when I'm thinking about consultation, I'm thinking about in a child care center, how am I going in systemically and looking at the entire center, not at the one child in the classroom that maybe they're having difficulty with, because we want strong social emotional practices within the center. And then what programmatically is occurring in that classroom, and how do we support the teacher? What's happening in that little one's home? And so when you ask me gaps, I think we know the answer, which is infant early childhood mental health consultation. The gap we run into is how do we fund that in the state of Texas to be able to provide it at the magnitude that it needs to be provided. And there's been many opportunities through grant funding for us to prove the success. It's how do we sustain that success going forward.
The gap that I'm hearing is that there's not a safety net. You either have kids who can get treated through insurance or a medical provider or a behavioral health specialist, and you have the kids who can't. And there's not necessarily a lot of in-between, or it's challenging to find those in-betweens, or sometimes there are other life barriers that cause families to not be able to access those. And so one of the things that you're mentioning is infant early childhood mental health consultation, which I think is new to people and exciting to us. But I want to give us a little bit of time to dive into that a little bit more about what does that mean, and why you're talking about the funding for it being so critical, and now it being very critical. Molly, do you want to dive into this with me a little bit? Talking about what is infant early childhood mental health consultation. That sounds like a mouthful, and how it's different than just infant mental health. It's a service in and of itself. So how does it fill a gap? What is it? How would you define it? And it's new to Texas. So let's tell our listeners what we're talking about.
Well, we've set the stage, I think, well for it in talking about how children's mental health develops, right? How that develops out of kind of these opportunities for social emotional learning and for an environment which is conducive to mental health. So what an infant and early childhood mental health consultant does is they build a partnership with the individuals, the adults in that child's life, to really set the stage for that positive mental health. So they may be partnering with a child care provider to think about that child care setting and how do we build for all kids in the class right? Really strong opportunities for that social emotional learning, for developing those skills. And maybe they partner with that childcare teacher for one particular child who may be having some particular skill gaps that they need some support around. Or they may even partner with that teacher to help them understand how they can adapt to that child's behavior to really make sure that that child, again, is having that positive experience so that they are continuing to get the education and the developmental setting in which they can grow and change and that we all want to see success. They may also partner with a parent or a grandparent to support them in thinking through what they can do to really support that child's development, to address concerns that may be coming up, to understand where some of those behaviors may come from, what are they communicating, what might that child need. That can be an important way that they can respond. And they can even do some observation of that relationship between the child and the parent or other caregiver to really be an external observer of what those interplays may be between the two. And then again, come in and support with some evidence-based strategies for how to strengthen that relationship, to build those skills across both partners, and really give that child the best possible advantages for developing a strong mental health.
Okay, so that sounds kind of like the consultant is almost kind of contextualizing the behaviors in child development, all of the things we've really been talking about. Child development, what's going on in the home, any maybe other factors that might be influencing or contributing to what behaviors we're seeing with that child.
That's right. And they have to have a lot of good knowledge and background in child development. They need to be able to pull from that as well as mental health, right? Having training in mental health, from mental health promotion to addressing mental health diagnoses, those skills they can also bring into that opportunity, that experience.
What I'm also hearing is, to address some of our gaps, though, too, is that mental health consultation doesn't have to happen with a diagnosis. It doesn't have to also happen with just allowed behavior. That an infant early childhood mental health consultant service is someone who's coming in to kind of give that blanket to a system that serves children and help those systems think about the child's development within their everyday actions and strategies, and also how their mental well-being is impacting that child and system. So they are providing an opportunity for children to have nurturing experiences wherever they are, at home, in schools, at doctor's offices, out at McDonald's. Consultants, right, are coming in to help people understand what infant mental health is and how it's kind of showing up in those different environments, and then help those adults and caregivers support those kids. And we don't necessarily have to have some of the restrictions that we have right now in other behavioral health services.
No, I would agree. I think we oftentimes think of it's a specialization in itself. You know, when you think about infant early childhood mental health consultation, the people that are performing in that capacity, it is distinctive from a mental health professional. You know, certainly our mental health professionals can be mental health consultants as well, but there is a specialization to this, and there is specific training to learn how to do this, because to know how to make systemic change or programmatic change and yet still be child and family focused, yet still be able to work across those sectors and take care of yourself while you're doing it through reflective practices. You know, there is quite a bit there that, and unfortunately we do recognize it as a profession. We do recognize it as something you have to have specific training for, because I do think that the impact, you're having a very broad impact on child, family, caregivers, environments that these children are in.
Yeah, I'm glad you bring up how distinctive it is from maybe some activities that a licensed mental health provider, say providing child therapy, might be doing, because this isn't therapy, right? Mental health consultants are not necessarily doing all of these things that we're talking about in the context of the activity of therapy. but rather through coaching, like you said, Molly, observations, and coming to an understanding with the child's family or the child's other helping people like teachers, etc., of some strategies that might help to support that child in those environments. So why are we talking about it today? What do you think is salient right now of why this is important for Texans to kind of care about early childhood mental health?
Yeah, I'm happy to jump in. I think when I think about here we are in 2025, 5 years from pandemic. We have to talk about the pandemic. I'm going to say that's one. Why is it important in 2025? Our little ones that were born in the year of the pandemic are starting school.
They're starting kindergarten.
Yeah.
They're starting kindergarten. So, when we think about rising mental health issues and concerns, and we hear about that, that is the topic of conversation. People do talk about it. I think it's important. Here we are. We have a population we can really address. Their growing up experiences between the ages of birth to 5 are very different than any other group of children we have ever had. So we need to be aware of these children as they're approaching kindergarten. We need to be watching these behaviors. We need to see what is it that this impact has had over the past 5 years on these children that are now entering into our school system. So I think that's important when I think about what is it about this year, because I think it's an opportunity for us to really increase the conversation and to move it from the youth and adult conversation to an early childhood conversation, because we have a population to talk about right now. And I think we can talk about it in the context of relationships. We can talk about it in the context of isolation, in the context of environments, learning environments. And when we talk about social emotional learning, we can talk about it in the context of that and relate it all to how different their early childhood experience has been than any other child we have in the public school. And so now might be the time to do that. And then I think in coupling with that is also thinking about the caregiver stress and the stress that they have been under during that period of time, not to mention economic stresses that they're facing today. So whatever's happening in our world with adults who are caring for young children is impacting our young children. And so I think that we also have to look at what is happening in our economy at this point in time. What is happening with people's work? Do they have food on the table? All of those issues that families are facing right now, trying to raise their children and support their children, is another reason we should be talking about this, because this is impacting their little ones as well. And then anytime the conversation comes up about rising rates of mental health crises throughout our nation, we should always reflect on prior years with that. I operate many programs now that cross all the way from prenatal to adult. And I will find myself every time saying, tell me the history, tell me the story, what happened when they were little, because we have to get to the root of things before we can address what we're seeing in terms of behaviors as well. So
yeah, I'm hearing a lot about kind of an upstream perspective of kind of looking at all of this so that we can understand what that person's now is, be them 5 years old or, an adolescent or adult later in services or systems or schools, et cetera, et cetera.
I totally agree with what Laura was saying. I think she is right on. A couple of other areas that I might raise. One of them is around schools. What we are hearing these days from schools is that our teachers are, whether that's K through 12 or our early childhood centers, our teachers are overwhelmed. They are not staying in the profession. They are turning over rapidly. And we know that that's going to cause disruptions to our young children, to the stability of the settings in which they are learning and growing and, experiencing those relationships. And so I think the things that we might be able to do to help support those early childhood caregivers to manage behaviors that may be challenging, to feel competent in their skills to support young children in the class, to, manage things that may come up, transitions that may be challenging, all of those things that can make the job really stressful. Those things can help us keep those teachers and those early child caregivers in those roles. Of course, we also need to pay them well, but in those roles so that our children can have some stability in those settings. And I just think that's so incredibly important. The other thing I would mention is, in addition to the pandemic, we are in an age where technology is changing dramatically and rapidly, and we're still learning what the impacts of that are. I think we know that technology plays a role in relationships and in our relational health, and I would suspect that that is also true for our youngest children. We've talked about the impact of kind of relationships as being the foundation for early childhood mental health. And as we move towards generations that have been with technology from their birth and they start having children, which, is kind of now, I think we're still learning about how that impacts the generations and the relational capacity and strengths over time. And so I don't have the answers, but I think we should be studying. We should be there to support kids and to support parents to make sure that they can build those skills that really support that long-term relational development and social emotional development.
It's almost a bittersweet that we're walking into a time in this field where it's uncharted territory. We understand, that there is infant and early childhood mental health, and we understand that there are some services to support it, but we also have maybe not yet knowing what is to come. We don't know what our natural disasters and how those are going to impact families moving forward that we've had recently, and how COVID is impacting our families now, that children are entering the school districts, how a technology is going to be impacting our children and their generational children. It's an uncharted territory, and so it can seem really unnerving, even when we have expertise and specializations and years of work in this field. So it's kind of a bittersweet to jump in and start studying, learning, deciding what we can do next to support our youngest ones. We have talked so much today about the complexities and the nuances of infant mental health, and Jenny and I are extremely grateful that both of you took the time to talk to us today. I just kind of want to pose one last question to you. What is something that you want all of our listeners, if they can remember one thing from our exciting conversation, maybe what is the one thing you want our listeners to walk away with today? And Laura, I'm going to start with you. What's one thing you want folks to advocate for or walk outside and talk about next?
I would think you just kind of summarized it. It's how do we keep learning and investing in this conversation? Because I think this is a conversation that has to be had. I think we have to recognize that infant early childhood mental health consultation has to be recognized as a distinctly different service and has to be available for the folks that we serve, because it makes a difference. We know the impact of it. We know that it's successful. We want it available to our caregivers, our parents, our providers out in the community for our little ones. So I think really an investment in that and continuing to learn. I think we still have a lot to learn. Mm-hmm. And I think our children will teach us as we watch them and learn from them with what they're experiencing. But I would say that. So keep the conversation going. And I think the more we keep the conversation going, then we identify ways to address some of those barriers that are presenting us with gaps.
Molly, anything?
Sure. So I think I would say that our community and our state seems to understand the importance of investing in the health of young children and ensuring that everyone has a pediatrician, a primary care provider, and then also in education. We want children to be ready to start kindergarten, to have some of those basic skills. And I think what I would want to say is that it is equally important that we are investing in our young children's social emotional wellness and mental health, because that really sets the stage for their physical health, for their relational health, and for their learning. we really can't enter kindergarten and be ready to learn if we don't have those social emotional skills well on their way to be able to take part in that. So I think that investment is really just as important.
Fantastic. Well, thank you so much to both of you for being with us today. We look forward to continuing this conversation.
Thank you for having us. Yeah.
That wraps up today's episode of Research to Reality. We hope this conversation offered some helpful insights and left you with a deeper understanding of the early childhood mental health landscape in Texas. You can also visit us at timh.org to learn more about our work and find additional resources related to this episode. Be well, and thanks for tuning in.